gonna do the prayer, Kim?
When we're ready to roll. You'll have to get the A button? Yeah. We're getting close.
I gotta call this. What's your name again? Risha.
They're gonna have a meeting with her next Sunday. Whatever just happened to him?
It's not good. We have an issue.
What, was she come to your house yet?
I'm gonna meet her at Lakeshore Park and then go to church.
Maybe we're good, because I wanna. I'd like to call the October 5th, 2020 regular city council meeting to order. If you would silence your mobile devices, the camera and audio is on, and our recorder is on. At this time, if you would please stand for the prayer and the pledge.
Heavenly Father, we ask you to let your inspiration precede this council's actions and all present here today, and your assistance further us, so that every word and work of ours may take its beginning from you, and so begun, may through you reach its completion. Amen.
I pledge
allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Ms. Sansky, would you please call the roll?
Mrs. Foglio,
Here?
Mr. Crawford,
Here.
Ms. Young,
Here.
Ms. Harris,
Here.
Ms. Haynes,
Here.
Mr. Spielman,
Here.
Mr. Roskovich,
Here.
Mr. Timonier,
Here.
Mr. Franklin,
Here.
Ms. Welch. And thank you again to Mr. Parkamaki for running the camera for us tonight.
Thank you. We have a quorum established this evening, and we are meeting the modified requirements of the Sunshine Law. At this time, we will have our monthly presentation from our City Health Commissioner, Ms. Hill, who will give us our COVID-19 update.
Hi, good to see you all.
Me too.
Give you a little update here. I'm going to start with some numbers. So tonight, Ohio is reporting 150,761 confirmed positive cases of COVID, 4,622 deaths. Our county itself, we have had confirmed positive cases 674, 102 hospitalizations, cumulative numbers, 48 deaths, and 590 of those folks are presumed recovered. So that's some good news. Here in the city, we've had a cumulative positive confirmed cases of 126, 20 hospitalizations, 5 deaths, 119 are presumed recovered, and we have issued 422 orders of quarantine cumulatively. I want to talk just a minute about the Public Health Advisory System. So that's the system that is on the coronavirus.ohio.gov site where the map is color-coded. So we've had the great fortune of remaining in the yellow, or level 1, which is active exposure and spread level, for many weeks. However, last week we did elevate to an orange. So, you know, orange is the level 2, which, you know, it just takes a couple indicators to be flagged to raise you up to that level. And we were only there for a week. A lot of it was related. We have the 2 indicators that were flagged were the number of outpatient visits related to COVID, and the percent of new cases that are community spread versus congregate living spread, or congregate living cases. So those were the 2 indicators that tripped and caused us to go to orange. This week, or last week, these are on Thursdays, it was back down to yellow. So I just want to let you know, those are just warning systems, just a good way to know how to conduct yourself, what's happening overall. It's not a perfect system, but it is, I find it to be helpful, so. We continue to work with our schools around COVID safety and reporting. Our schools, we're getting in the groove of doing the weekly reporting with our schools for their staff that is positive and their students that are positive. These reports are posted on coronavirus.ohio.gov. I do want to say that our schools have just done an excellent job. They've done an excellent job. Any positive cases that we've had to investigate, they have been very, very helpful, providing us seating charts, providing us bus seating charts. The kids and the staff have been great with masking compliance. They have used barriers, and they have done their sanitizing. And, you know, like I say, they really do want to stay open. The kids want to be there, and they are, it's evident by what they're doing. And any cases that we have had in the schools, we've been able to only, really only have to quarantine a handful of people because they are careful with their movements and because they're doing all these mitigating strategies, which are very helpful. We continue also to work with our nursing homes and our long-term care facilities. They are also doing weekly reporting to us, and they continue to do bi-weekly testing of their staff. And again, I have to shout out to our nursing homes. You know, that's not easy, getting tested every week and managing that amount of work, but it's protecting those residents and our very vulnerable folks that live there, and they've just done a wonderful job. Our environmental health director and her division has been very busy as she's been throughout this whole pandemic, dealing with ensuring safety at sporting events. We've been dealing a little bit with holiday celebrations. I think Manager Timonier will talk to you all a little bit about Halloween here in the city. I know the 3 health departments of Ashtabula County got together and we wrote some guidance for Halloween based on the guidance from CDC, based on the guidance from the Ohio Department of Health, and then giving it a local flavor. So that document was used by city managers and villages and townships to hopefully organize a nice, safe Halloween celebration for our kids. Winter holiday guidance. It seems like it shouldn't be here, but it's coming. So we're already talking about winter things. Indoor, much more indoor activities, people wanting to do sporting things indoors, and holiday celebrations. So we're turning our attention to that, and knowing people want to make those kind of plans. The nursing division, we've been very busy because we are doing COVID activities and participating weekly in conference calls with our zone, talking about the COVID vaccine that will be coming eventually. And just planning that out and talking about, the cold chain storage and how that might look and how it might get delivered and how we have to administer it, and priority groups, who might be the first, the second, the third, and just, talking it all out and trying to take lessons learned from other events that we've had, real life events, H1N1, regular flu events, things like that, and things from around the world that might inform some of the decisions that we're making. And then my nurses are extremely busy giving seasonal flu vaccine. Our phones are just ringing. We're doing flu vaccines by appointment. Been a little bit of a learning curve. A lot of people just come down. We used to just have normal times, have open hours. We can't do that now. People are starting to understand what we're doing. Every Monday, we're doing a drive-through flu clinic here at the municipal building. It's from 2 to 4 p.m. That has been pretty popular. We had a few logistics to work out with, a hotspot and wireless printing and so on, but Jim's been helpful, Kyler's been helpful at Great Wave, and we've worked the kinks out of it, so we're happy to do that. So we'll continue to offer that Monday 2 p.m. to 4 p.m. drive-through clinic as long as we're able, as long as the weather, allows us to do so. And we've been working out of our trailer, which has been really nice to give us some shelter while we're working through that. And people just pull up in their cars. We go to the car side. We get the data. I know Kim's
was
nodding
there
her head.
last week.
She was one of our patients.
One of the first.
And, taking their demographic information, and then we have to go back into the trailer, and we have to put that into our computer, which spits out the sheet that we need for the patient to sign, and then we administer the vaccine. So it's been going, pretty smoothly, so. There has been a little bit of a supply chain issue. I think it's Sanofi there's a little delay in getting the vaccine out, so we seem to be getting it in bits and spurts. So we'll just get through. Hopefully they'll catch up with the demand. I did want to talk to you for,
Ms. Hill, before you get off the topic, Mr. President, when you talk about the drive-through clinic, that form with the demographics that we have to fill out, if you want to save yourself some time, we did just upload that to the internet, and we made it a fillable PDF, so you can fill that out and print it out and bring it with you, and that'll save the time of us having to ask you those questions when you come in. And then if you have multiple people in your family, you can print it out and then just change the name instead of all the insurance information at the bottom. Just change the name to one of your dependents or your spouse, and then print those off, bring them in, and it'll just be quicker to do it that way.
yeah, I forgot about that. That was actually Jim's idea, to put that online, and I was like, oh, that's wonderful, great idea. So hopefully people will embrace it and do that at home, because it'll save some time when they get here. Thanks, Jim. I want to talk a minute about the coronavirus wastewater monitoring program. And I think you've been briefed a little bit about this, but I want to talk a little bit more about it. So we are just getting started. Our Ashtabula wastewater treatment plant is participating. We've been in communication with Craig at the plant, and we've also reached out to the county health department, because our wastewater treatment plant serves areas that are included in the county. We, Plymouth and Saybrook and Ashtabula Township. Yep. So if anything needs to be put out for a press release or something, it would involve both health departments, because they're residents from both health departments. But anyway, I just wanted to give you a little briefing on it. Samples of untreated wastewater is what we're monitoring, and we're monitoring for fragments of COVID virus. This could be a really helpful tool in our toolkit. This could give us an early warning that disease is coming to our community. It might give us a 3 to 7 day warning, because you can shed virus. A symptomatic and an asymptomatic person can shed virus in their stool early on like that, and that might give us a heads up. We need to talk as the two health departments, what are some of the, if we do get an alert, if we do get a higher level, and we have that early warning, what will we do as a health department? We would send out community messages, letting the community know that, we want you to take some extra precautions. We want you to be very vigilant with your hand washing, your masking, your distancing, your sanitizing, avoiding crowds, because we know that we're going to have a blip or a little rise in most likely in positive cases. And then we'd also alert our partners, the hospitals, the nursing homes, the schools, our university, daycares, and physicians, because they would need to know that too, and might modify their daily procedures just a little bit to respond to that. And then, depending on what's happening, we might need to ramp up some more testing, and we might need to, get ready to do a lot more contact tracing. So it might be a really good tool in our toolkit, and it's just an interesting project, and I'm really looking forward to, seeing some of that data and how that all plays out. It's currently on coronavirus.ohio.gov. However, the map, when you click on it, is being adjusted. It's not showing the full area that our wastewater treatment plant serves, but they're working on a conversion so that you can see the full area. And data I don't think it's available just yet. Is it?
Just was posted.
Just was posted. I know
So-
he sent 2.
Yeah, I don't know if you can interpret this. I hate to put you on the spot, but so we did a collection on September 27th, and the results are up there now. So million gene copies, it's called MGC per day, we hit 13,000.
Okay. So my understanding is we need to get a baseline. We need to see, it's not, and you can't compare our wastewater plant with anybody else's because it's unique. So you don't compare plant to plant, and you watch for trending. So we would watch that for trending up to give us a warning. And I think they need maybe 3 samples to get that baseline, and then they start looking for that trending.
And I think, if I'm not mistaken, we take 1 sample a week right now.
Right, and I did talk to Craig because some of the wastewater treatment plants are doing 2 a week. And I'd asked him if he was offered that, and he said no. So we sent out some emails today, and it looks like he is going to do twice a week because I think it would give us a better picture.
So, I mean, at least even with just that data, it's here, folks. I mean, this isn't something we're joking around about.
Right.
I mean, now we're picking it up in the waistlines too.
Right.
And this is RNA fragment, so this is the dead cells of the coronavirus that this test is picking up, correct?
Right, and yeah, and I think the point needs to be made that, our wastewater, has that type of thing in it, but then when it's treated for all this type of thing, and comes out treated and acceptable, so, that is prior to treatment, so. And that is the end of my report, and I'm happy to answer any questions or have a discussion, or.
Ms. Hill, if the water sampling does go up, and you need to let everybody know, are you going to be using the emergency management system, the E911, or?
That's a tool in the toolkit, press
Okay.
releases, we have lots of things we could do, website postings, yeah.
I
But
think
that's a
most
good
likely
suggestion.
We'll utilize our Facebook a lot too in those cases. It's not, I don't know if it will rise to the level of a 911 type call out.
Yeah.
I mean, I guess it really depends on if we make some local decisions that, these numbers are getting way out of hand, and we see spikes in actual positive testing and different, or overwhelming at the hospitals, and we have to make some local decisions that the county health department and our health department would be making, we might do some of the reverse 911 type calling, but for the most part, it'll just be press releases and Facebook posts and different things like that.
Right. Yeah, that's a good question, though, and a good, reminding us of that resource that we do have, and, like Jim says, this is brand new, OSU, I think, is a big part of this, and this study was funded by the EPA, and it's just, it's new and interesting, and I think it'll be interesting to watch it and see how much it helps us and so on. So I'm really proud of Ashtabula for stepping up and being part of it. So.
Ms. Hill, I've been meaning to ask the last couple of weeks because it just sticks with me. We had 102 hospitalizations for COVID, I think is what you said.
In Ashtabula County, yes.
Yeah, and 48 deaths, and that seems like such a high percentage. Is that comparable to other areas, or is that seems awful high?
Yeah, we are a little high. It has to do a lot with our aging population, to be honest with you. We had early on, if you remember, a lot of situations in our long-term care facilities, and it spread quickly, and they did their very best to respond, but that early on stuff is why that's weighted so heavily that direction.
Okay.
Yeah.
I was thinking, but it just
Yeah.
seems so high to me.
Yeah, and the only good news is that I feel as if even though we do occasionally still have hospitalizations, and they are scary, and I've seen all ages hospitalized. There's a 6-year-old in the hospital, not in our county, but in a neighboring county right now, and it's very frightening. But we are seeing it seems like less hospitalizations. Either people are more aware and we're catching it sooner, but that would be a great trend if that would continue. So.
I think our death rate has slowed. I mean,
Yes, it has.
We've had
It
2 or
has.
so in the last
Yeah,
couple.
so, and I think it's proof that the mitigating things, all the work that we're doing, all the sacrifices we've made, that it's helping. It's making a difference. I'd like to think that it's really making a difference, so, thanks for that question.
Are there other questions? I know Mr. Timonier is gonna give us some Halloween guidelines, but even though there'll be Halloween in the age of COVID, we're not going to totally healthy snacks, are we? There'll still be candy and.
There must be some
Must be
candy.
some-
It would
I
just,
wanna make sure that-
wouldn't be Halloween without that, right?
Okay. I
Yeah, it's fun to read the statistics, and then the next week, you know, if it was normal times, we'd be giving out toothbrushes and
Yeah.
reminding them, yes, eat your treats and brush your teeth, guys. All right, anything else?
Anything else?
Okay, good to see you all. Take care.
Thank you so much.
Thank you for all that
Thank
you're
you.
doing.
At this time, council will entertain a motion for an executive session to discuss personnel employment.
I'll make that motion.
Motion by Mrs. Foglio,
Second.
second by Ms. Haynes. Please call the roll.
Mrs. Foglio,
Yes.
Mr. Crawford,
Yes.
Ms. Young,
Yes.
Ms. Harris,
Yes.
Ms. Haynes,
Yes.
Mr. Spielman,
Yes.
Mr. Roskovich.
Yes, so we will go into a brief executive session by a 7-0 vote. I believe Officer Parkamaki has some activities planned for the. I just kid. It's gonna go to what, Mr. Officer? Blank screen?
We'll have just a message on here.
And there'll be no sound. Or did I already say that? Because there is. we back, officer? Okay. All right, thank you. We appreciate the public for staying with us, those of you that did, so we appreciate that. We are out of executive session, and we are going to resume with our public portion of the meeting. Ms. Sensky, are there meeting minutes to dispose of?
Yes, I have two. The president called the September 8th regular meeting to order at 7 p.m. The Ward 1 counselor offered the morning prayer, and the Pledge of Allegiance was recited. The members present were Ms. Harris, Ms. Haynes, Mrs. Foglio, Mr. Crawford, Ms. Young, and Mr. Roskovics. The officers present were Mr. Timonier, Mr. Franklin, Ms. Welch, and Mrs. Sensky. Mrs. Foglio moved and Ms. Haynes seconded to excuse the vice president from the meeting. Motion carried. The president called the September 21st regular meeting to order at 7 p.m. The Ward 1 counselor offered the morning prayer, and the Pledge of Allegiance was recited. A moment of silence was observed for a City of Ashtabula resident and retired Ashtabula firefighter Thomas J. Levesque, who recently passed. The members present were Ms. Haynes, Mrs. Foglio, Mr. Crawford, Mr. Spielman, and Mr. Roskovics. The officers present were Mr. Timonier, Mr. Franklin, Ms. Welch, and Mrs. Sensky. Mr. Roskovics moved and Ms. Haynes seconded to excuse the Ward 4 counselor from the meeting. Mr. Roskovic moved and Mrs. Foglio seconded to excuse the Ward 3 counselor from the meeting. Both motions carried.
May I have a motion to waive the reading of the minutes?
So moved.
Second.
Motion by Mrs. Foglio and a second by Mrs. Haynes to waive the reading of the minutes. Is there a discussion, Mr. Spillman?
No, I just moved up here, so.
I'm sorry, I apologize.
I'm
You're
trying to
right.
figure out the microphone.
Oh,
The switch
okay.
is confusing me.
All in favor?
Aye.
Anyone opposed? The minutes will stand as approved. We will move on to the city manager's report.
Thank you,
For his
Mr. President.
formal request.
Yes, I have a few things here. First, I would like an ordinance to enter into a consent agreement with ODOT for the purpose of providing sign replacement on Route 20 within the city limits of Ashtabula.
Mr. President?
Yes.
I move on the manager's recommendation.
Second.
Motion by Ms. Foglio and a second by Mr. Crawford. Is there any discussion? All in favor?
Aye.
Anyone opposed? We will add that item by a 7-0 vote.
Next, I would like an ordinance to enter into an agreement with Fund Superior Sales out of Pennsylvania for the purchase of a 2019 ambulance through the State of Ohio State Procurement Program to be utilized in the fire department in the amount not to exceed $295,757.84. This purchase is funded through the CARES Act, Fund 260.
Mr. President?
Yes.
I gladly move on the manager's recommendation.
Ms. Foglio moves.
Second.
Ms. Harris seconds. What was the price again, Jim?
Mr. President, it's $295,757.84.
195,000 for an am. Wow. Okay. Good for us. Any other discussion?
Mr. President?
Yes.
Just to kind of go over this, because I know, like you, that number has shocked me for quite a while here. Both in the fire and police department, anything with bright lights and sirens costs a lot of money. So the CARES Act funding, which we're using to purchase this, so it's not coming out of our general fund or not coming out of our PI, which is one of the reasons that we've known we've needed an ambulance but never been able to budget for because of the expense of it. And also we just purchased an engine 2 years ago, I think it was, for the fire department. So when the CARES Act funding changed and guidance came out that purchases like this could be made, we jumped on it as quickly as we can, as did many other EMS facilities and fire departments. So one of the things, or a few of the things here that qualify us to use our CARES Act funding for this purchase. The ambulance will come with an ultraviolet air purification HVAC system. It will have a UVC air surface disinfection lamps in it. We'll have plexiglass dividers between the drivers and our patient compartment. It has extra outside ventilation for better air exchange within the ambulance, antimicrobial handrails, and we're also installing a power cot system with a power load system to minimize close contact with our patients as we're transporting them. It also allows us to have less downtime to decontaminate after a patient, especially now in the world of COVID. With all of those things, we don't have to take the ambulance out of service for a certain amount of time. It will decontaminate it as we're moving along here. So, because of those things, number one, it's going to very much increase patient safety. It's going to increase safety of our employees as well, and that's why it's a qualifying purchase in this. Having said that, we did get the first round of CARES Act funding, which allowed us to take everybody off of furlough and bring our fire department back off of layoff and some of the furloughs that were going on in the police department and other areas of the city. We received a second round, which this pretty much covers. There is now a third round coming, which we're expecting upwards of $600,000 to $700,000. Unfortunately, this money has to be spent by the end of the year, and it's very restricted on what we have to spend it on. We're advocating for a little bit less restrictions and a little bit more time, or a lot bit more time. However, I guess this is a conversation outside of this, but we're putting together other programs that will reach out into the community for that money, unless things change where we can hold it over into next year. As we're starting next year's budget, we're worried about next year's budget. So we don't want to have to give any money back to the state, and that's why we're trying to most effectively use the money and purchase things that we definitely need for the city. And then the next round will most likely, if not certainly, include funds to go back out in the community. And I'll be bringing those to you. I'll actually mention them in a little bit.
Okay, all in favor of adding this?
Can I ask two
Yeah,
questions?
go right ahead. Yeah.
What lifespan do you expect to get out of the ambulance? Ballpark. How old's the other one?
I want to say the other one is 10 to 12 years old.
Okay, that's what I thought. And then the other bells and whistles you just talked about, that's great for this coronavirus, but it also is beneficial for other things that it's not just exclusive to this. I mean, it's great for purifying the air and
Absolutely.
any sort of chemical environment that they might encounter. So it's not just that the other bells and whistles are going to do.
That's correct.
Right.
Yes, any kind of bloodborne disease, any
Right.
kind of airborne disease, anything like that, this will
Right.
definitely help keep our patients safe and keep our employees safe.
Thanks.
Thank you. Any other comments or questions? All in favor?
Aye.
Aye.
Anyone opposed? We will add that item to our agenda by a 7-0 vote.
The last ordinance I would like for tonight is an ordinance acknowledging the hiring of Mark Verzella as the Assistant Superintendent, Director of Pretreatment, Class 3 of the City of Ashtabula Wastewater Treatment Plant.
Mr. President,
Yes.
I move on the manager's recommendation.
A second.
Motion by Ms. Foglio, a second by Ms. Young, to approve the hiring of Mark Verzella for the wastewater treatment plant. Is there any other discussion? All in favor?
Aye.
Anyone opposed? We will add that item by a 7-0 vote.
Thank you, Mr. President. Just a few announcements. We have resumed picking up leaf bags curbside. Remember, this is every other week, doing the wards, and then the harbor route is considered a different week. I know there's always questions, what is the harbor route? So that is Walnut Boulevard south. So the most northern would be Lake Erie, Walnut Boulevard south to West 19th Street, Carpenter Road. And then it goes to the city limits west to Saybrook and the Ashtabula River east. So that chunk in there is what we consider the harbor route. And then when we say the wards on that list, that's everywhere else is the following week, okay? Right now, we are in the wards this week, and then we'll be back in that harbor route next week. So and that is going off and on every other week. It is on our website, that schedule, so people can take a look at it. We would love for people to minimize the use of the front of Public Works. Keep those bags for an extra week, and we'll be around to pick them up. It just gets real hectic down there at Public Works and unsightly when so many bags are being dropped off. This way, we'll also be able to monitor whether it's our residents or people from other communities utilizing our service there. So if you could, just keep those at your homes, and we'll be around to pick them up. We ask you to put them out on Mondays rather than just on your garbage day or any other day of the week. We don't have a set we're here on Monday, we're here on Tuesday, we're here on Wednesday kind of route when we're doing this, because you just don't know how many bags are out there, and if we can get it done earlier in the week, we'll get it done. So we ask you to put the bags on Monday, and they will be picked up by Friday if you're in one of those areas. The long-awaited announcement on trick or treat. I know you've seen a little bit of this in the paper. Our health departments all got together and decided a few things. So the health department is strongly recommending all of our cities, villages, and townships, if we're going to hold trick or treat, to hold it on Saturday, October 31st, which falls right on Halloween this year, but for all the communities to do it from 4 to 6. And the city of Ashtabula will be participating in that, and we will hold ours from 4 to 6. This is done primarily, in past years, communities will hold their trick-or-treats on different days and different times, and you just have carloads of kids going from community to community. So we're hoping that this minimizes that and keeps people in their own communities. We're encouraging all of the people of the city of Ashtabula to stay within the city and enjoy trick-or-treat. We will post these guidelines on our website. I'll try to get those up tomorrow for you. But obviously people who are sick with flu-like symptoms or COVID-like symptoms should not go out for Halloween. I think that's self-evident, but unfortunately we have to say some of these things. Also, when we've run into this situation a couple times with different things, if you are awaiting results of a COVID test, you should be quarantined. You should be doing that on your own. You don't have to be. However, it's kind of important if you've gone to get the test that you don't expose other people for the day or two while you're waiting for those tests. So try to lay low. So if you're awaiting test, we ask you not to participate. Obviously, people that are in quarantine shouldn't participate. The people giving out Halloween candy to trick-or-treaters, it should be individually wrapped. We don't want any open type foods or candies. Should be wearing a mask as well, and gloves, having hand sanitizer available for yourself. Don't let kids or anyone pick out of a common container for the candy. Turn your porch light on if you're going to participate. Those families that are going around, if you see the porch light, there are. If you don't, then they're not. We ask that the people participating in trick-or-treat also wear masks. And families should stay together. I know that groups like to go out together and the kids get together, but families really should stay together. Your household should stay together rather than introducing other households around with you. Try to, again, stay the 6 feet apart, and limit those indoor or large outdoor Halloween parties because of the increased risk. And again, we've shown you, our indicators show that this is not just in congregate living anymore in the city and in our county. It is communal spread at this point. We've actually been doing very well in our congregate living, knock on wood, to date. So it is out there, folks, and just take some of those extra precautions. We want you to have some fun, but we also want you to be safe. There is no harm, no foul if you don't want to participate. That is totally up to you, that's fine and respected. And obviously those that are at higher risk, you probably shouldn't participate in this. And that is all well and okay. So please be safe, enjoy yourself, but do remember we are in a pandemic. We did struggle with this quite a bit, whether or not we should have Halloween or not. The county did struggle with this as well. However, with the guidance that did come out with the state, and I think by all of us doing it on the same date, we're doing the best we can, and we just need you to make some of those good decisions as well. So we will be moving forward with Halloween on Halloween from 4 to 6, and more guidance will be on our website soon.
Mr. Timonier?
Yes.
I just a point, when you say that people giving out candy are going to wear a mask, and the kids are going to wear a mask, but I think it's important to, if they have like a Ninja Turtle mask or something,
Yeah, that's not.
you should have a mask underneath,
That's correct. You should
because
have
that has an opening and
a
stuff.
surgical type mask or a cloth mask that most people are wearing out in the community right now. Have that either as part of your costume or underneath the actual mask
Underneath
of the
mask,
costume.
yeah, you
Yes,
say,
yes. The mask that you buy at Kmart or Walmart or anything like that you get offline, that's not considered a mask. It has to be somewhat covering your nose and your mouth.
Okay.
The other thing I mentioned with the CARES Act funding, so when this third round does come, it's being approved by the state of Ohio to distribute the rest of their money. Today I worked most of the day on putting together a program similar to what the county did for grants to businesses. We've also discussed grants to mortgage and rent assistance for people that got behind on those things during COVID. We're just looking at other different ways to, with the money that we receive, again, that we cannot use for our own operations, to somehow distribute that out into the community so that we don't have to give it back to the state. And again, we're still advocating both on the state and federal level to have some of this guidance changed as this goes along, so that number one, we have a longer time to use the money, and number two, some of those restrictions are lessened so that we can use the money effectively. But hopefully I will share with you some of those things we'll have to get it by the next meeting and approved if we're gonna get it out there by December. So I will share some of those items with you shortly. Mr. President, that's all I have for my report.
Thank you, Mr. Timoney. Are there questions for the managers or comments? Mr. Franklin?
Thank you, Mr. President. I do not have a report this evening.
Thank you, Mr. Franklin. Ms. Welch is not with us this evening, but I believe she has two requests. Who will read those to us?
I can do that, Jim.
Okay, go ahead.
Ms. Stensky?
Yes, she wanted to formally request an ordinance to make supplemental appropriations in the Water Pollution Control Fund for current expenses and other expenditures of the City of Ashtabula, State of Ohio, for the period January 1st through December 31st, 2020.
Mr. President, I move on the Finance Director's recommendation.
Ms. Foglio moves.
Second.
Mr. Crawford seconds. Are there questions? Although Ms. Welch may be misreferred. Seeing no questions, all in favor?
Aye.
Anyone opposed? We will add that to our agenda by a 7-0 vote.
Ms. Welch is also requesting an ordinance authorizing the city manager to enter into an agreement with the Office of the Auditor of the State of Ohio to assist the City of Ashtabula as fiscal agent for the Ashtabula Health Department in the conversion of cash reporting to GAAP for fiscal year ending December 31st, 2020.
Mr. President, I move on the Finance Director's recommendation.
Ms. Foglio moves.
I second.
Ms. Young will second. Thank you. And any discussion for the gap funding? All in favor? Anyone opposed? We will add that item by a 7-0 vote. And I believe that's all for Ms. Welch. Ms. Sensky, do you have anything for us this evening?
Yeah, just a little bit. I did last week apply for an online scholarship program for some of the classes that I'm taking. Unfortunately, it won't be for the 2020 year. It'll be for the 2021 budget year. And if chosen, there's only two eligible members out of each region under the IIMC International Institute of Municipal Clerks, and they have 9 regions. But only 2 people out of each region will receive the $100 reimbursement. I will definitely be taking online programs in 2021, so let's keep our fingers crossed for that. Saturday, I attended my first Athenian Dialogue, which is a sort of like a book club, but I get 3 education points for it. I read the book Becoming by Michelle Obama, and it was, to me, a very interesting book because it ran the gamut. It wasn't political. It was more just a story about her life and what she's done, and it was quite interesting. And the other interesting fact is I spent 6 hours on a Zoom version of Athenian Dialogues, and there were attendees from Alaska all the way to Florida and everywhere in between, and it was very exciting and interesting to talk to all these clerks. It was supported by the clerk of La Quinta, California, and if it wouldn't have been for COVID, I wouldn't have been able to attend via Zoom because there's no way I could go out to La Quinta, California. So I'm very appreciative of that fact, and I'm glad the IIMC made that change in their practices. I also wanted to say that I'm wearing a mask today that was the brain child of Arlene Ryan, a citizen of the city of Ashtabula. She called me about 2 months ago, I think, and asked if the city was going to have masks that, showed that Ashtabula proud kind of thing. And I said that I hadn't heard of anything, but I'd try to see what we can do. And I was lucky to be able to get a sponsorship for the masks, and with Richmond Transportation, made in Ohio on Bridge Street, made the masks. And I was able to use the Visitors Bureau of Ashtabula County for the design. And it's really all because of Arlene Ryan. And so I thank her, and she's so sweet that I gave her some masks, and then she ended up buying 4 more because she's just really excited about these masks. So I'm glad to be able to help her with that.
Where's the math? Okay. Thank you. Anything else, Ms. Zensky?
That's it.
Okay. Was it a 6-hour Zoom meeting in a row? 6 hours?
Yeah. We did have a short break, but it was California time and not my time, and so it went from 11:30 to 6 o'clock.
Oh, that's a long time to be on the computer. Okay. All right, thank you, Ms. Zensky. We have committee reports. Ms. Haynes?
We will be having a committee meeting October 13th at 4 o'clock.
Thank you. Finance and Personnel, Ms. Foglio?
We will be having a meeting on October 16th at 8 a.m.
And Mr. Crawford, I believe you have a report from your Public Works Committee?
Yes, Mr. President. On Monday, September 28th, the Public Works, Public Utilities, Cable, and Schools Committee had a meeting. Our invited guest was Dr. Potts, the superintendent of the Ashtabula City Schools. We had asked Mr. Potts ahead of time a couple of questions that were on the people's minds of the city, so he went over those. Dr. Potts updated the city council of the school year. The school opened remotely using Google Meets, where the kids actually get online at the time of their scheduled time of their classes, and they have a live class from their own home. When they were making those decisions, they did use resources of a lot of other agencies to drive to that point. Moving forward, he said on October 12th, kindergarten through 4th grade students will begin a hybrid model of school attendance, where some will attend in-person schooling Monday and Tuesdays, and the balance will have classes on Wednesdays and Thursdays. And the days off, they will go back to the online, where the teachers will teach them online. So it's slowly integrating them back into the controlled environment of the school instead of just dropping them all at one time. So it's to help work them back into that. They will have maintaining 6 feet of social distancing. The rooms will be rearranged. Elementary rooms typically will be holding 12 students per class. In the high school, when they do get to that, they're looking at a 15 to 17. Huron, Ontario, and Michigan class days will be at 8 a.m. to 1 p.m. Superior Elementary days will be from 9 to 2. Just for the benefit to help the kids, the students will receive breakfast when they're coming into the school each day. They will be provided a snack midway through the day, and before they leave, they will be given lunch to bring home. So the kids will be able to get balanced meals while they're at school and through their days. They are still continuing with the 6 remote sites around town where they have been giving out school lunches since the spring. He said in the spring they actually were averaging about 2,500 students a day were receiving a free meal. Once school started, it did drop down, he said, but now they're actually back up to around 2,000 students are being able to get meals from the different locations around the city. Another question he had for Dr. Potts was the Mother of Sorrows purchase. We tried to get Dr. Potts in way before when it originally purchased, but this was the first chance we were able to with COVID. He did say that they bought the Mother of Sorrows school building. It was basically they bought it because they heard rumors of a charter school was coming in and wanted to drop into that building. And what he said was they receive $6,000 for each student that attends their schools, and that would have been a little over $1 million a year the school system would lose if that charter school would have dropped there. He said The money they used to purchase wasn't from any funds that were from levies or anything to take school or any equipment away from the kids. The money that they used to buy the building was actually from the funds of the sale of all their other building lots when they went to the campus-style community. He said that was actually designated, it was a select fund, and they couldn't use the money for anything other than that. So that's why they utilized that money to buy that. One of the other questions we had for him was from the topic that we all received the email from, I believe it was Portsmouth, the councilman, where he had the resolution having the schools against racism and bullying. So we asked Dr. Potts, what does the city schools do and how do they handle it? And he actually went through, they have instituted many programs with the students and the faculty. He said they have been with him and directors brainstorming ways to ensure systematic racism is identified wherever it exists and not ignoring it. They strive to ensure each student receives equal opportunity to be successful. They recognize cultures in many ways. Nearly 2,500 students participated in a week-long program of age-appropriate activities that culminated in the Trailblazers Assembly, devoted to celebrating African American graduates of the school and the community leaders. With that, he said the school system does want to produce a supportive and welcoming atmosphere for anyone by being intentionally about topics of racism, bullying, respect for each other, and always striving to do better. He did say they have a Facebook page, Twitter, and Instagram, along with their website, but he said it doesn't really get recognized, the website. And one of the chairs actually said they need to help promote that and get that information out for everybody to see. So it's just not being found. They could actually find it and be there for them. We did tell him that anytime he needs assistance, that's what that committee is there for. So if he has anything he needs help with, we could help him out. The city manager did the report for water pollution. And as you heard from Ms. Hill, the state did get their first test for the monitoring of the gene fragments of COVID, and Ms. Hill was able to explain that a little more. There is coming up, Mr. Timonier said there needs to be a comprehensive study of the plant and the collection system, including the evaluation of pipes, pump stations, to identify areas of inflow and infiltration. The results then will be interpreted to the order to determine for increase in rates determined or needed to maintain the system for the next 5 to 10 years. The initial preliminary cost is a staggering about $500,000, but it will be a full study which helps give the city a path forward to move forward. So that is something. Mr. Timonier said he was going to try to get the group in for our next meeting so they could give us a little bit more information on what the comprehensive study is, how it goes about, and what they'll actually be looking for. So we're going to hopefully try to get them in for our next meeting. For Public Works, the past weekend, the lines were painted at the tennis courts, so those have been done. It was brought to the city's attention that tree trimming needs to be focused at the site. With fallen branches that could actually deteriorate the court and cause injuries. So the city has to look at removing some of the tree branch, not all the trees, but just trim them back so they're not going to drop anything inside the new courts. So that's something they want to get done. Walnut Beach does remain open and accessible. There is no lifeguards and the concessions are gone for the season. They do have porta restrooms down there if people need to use them, and those are regularly on maintenance and taken care of. The street sweeper made it back from repair and has been back on routine routes for the last few weeks, so that's a good thing. The catch basin repairs and street openings continue to occur in order to finish up before the snow flies. So there's that nasty word, snow. Plow trucks are actually now being readied for service, so they're getting ahead of that and on the ball so that doesn't catch them. The last thing we actually talked about was the trash and recycling. When we went through, we've been getting, Mr. Timonier does get a lot of calls, sanitation gets a lot of calls, some of the counselors have been getting calls. So we tried to make it to get it understood that for the city, that wards 1 and 2, the residents all received 164-gallon recycling, and 1 64-gallon, which is trash. Wards 3, 4, and 5, they are limited to 2 32-gallon cans that if they purchase themselves, or up to 6 bags of trash in those 3 wards. Where was it? Wards 1 and 2 are allowed to ask for extra recycling. They just have to contact sanitation. If they do want more, there's no additional cost to that. They would just have an extra bin at their property. If anyone in Wards 1 and 2 want an additional 64-gallon container, it is an additional $10 fee every month that would be base set it. So if a family knows they produce a lot of trash, take the option, get the extra trash can and have it. We have had some residents say they put trash out and it's not picked up. We've had some people say they just have a lot of extra trash 1 or 2 weeks, but not the whole year. I brought up the idea to Mr. Timonier is there possibly back like in the days when they used to put the sticker on the recycler or the trash or the lawn and bags? If there was a way that a family knew, all right, we're having an event, something that we're going to generate a lot, that they could prepay for a sticker, put it on the bag, and then when the trash guys come by, they know it's already been paid, the city is good, then they could have those picked up. So that's something we're going to look at to see how that would work, see what it would cost, so then people wouldn't be, I left my trash out and no one picked it up, now I've got to pick it back up, it's not sitting on the tree lawn for another week. So as a way to maybe improve the system a little. The goal for the city is actually, we asked about for recycling because we've had a couple people ask, what about the rest of the city? The goal was to have curbside recycling throughout the whole city, but the cost is roughly $2 million. In doing that, it's actually buying 2 brand new garbage trucks that have 4. To pick the lifts, it actually, where they would pull up next to it, it would pick the trash can and dump it. $2 million is a lot of cash. So that's something that would try to get to. People that are in 3, 4, and 5, or if you have enough in 1 and 2, you can bring that to the sanitation department. They have bins there that you can drop off and recycle.
Mr. President, and actually, the recycling is brought to you by the solid waste district of the county. So not only the bins that we have at sanitation, and again, the gates at sanitation are 7 to 2:45 Monday through Friday, and I believe it's 7 to noon on Saturday. Those hours are on our website as well. There's other bins in other locations throughout the county. At Saybrook Township Hall on Route 45, there's bins. At the elementary campus, I can't remember which building, but it's the northwestern building on the campus. They have, I think it's Ontario, they have a recycling bin there too. So if our gates are closed, there's other drop-off areas within the county that you can bring your recycling to, and you're more than welcome to use those.
Thank you, Mr. Timonier. Along with the trash pickup, the city does see that there is a lot of repeat offenders that overload and take advantage of the system. They see that the workers are out on the trucks, realize that, they see that every week, so they know it. The sanitation department, you can call them ahead of time if you know you're going to have, or to schedule to have it picked up. Mr. Timonier said actually, like a lot of landlords will actually use that where they're cleaning out house. They'll come and give them an estimate. Don't put it on the tree lawn ahead of time. Let the city come to you, figure out so that can be picked up. So if you don't want to haul it, but it can't be the day of pickup. It has to be ahead of time. The other thing is I did have a resident of Ward say she has bad arthritis and can't get out to the street all the time. Mr. Timonier said if she calls the sanitation department ahead of time, they can make arrangement where they could help her and get it to the street for her if she needs that. And any resident, if they need that, just they have to give enough notice. They can't call the day of. And that was really the update. Mr. Timonier, was there anything I missed?
You did great.
All right. And our next meeting is scheduled for October 26th at 5 p.m. in here. I will miss that meeting because it's my wedding anniversary, and Ms. Harris will run that meeting, and we'll have a good
Very
meeting.
good. Thank you,
Thank you.
Mr. Crawford. Very thorough report. And I like the idea of the going back to the sticker idea. That'll be something to explore. You know, you're going to have extra garbage birthday week or whatever, and you want to buy an extra sticker. That's Something to think about.
Mr. President, actually, Ms. Sinsky actually found a sticker that would probably be appropriate that we're looking into to help see what that would cost and what it would work. But they're already pre-made. They're already out there. That
Something to think about, yeah.
Yeah, Mr. President, there's several communities in various places that use stickers and or like wraps, sort of like you would use when you go to the amusement park, and it has a number on it. So I would assume that people would purchase a sheet of the stickers, and they would be numbered sequentially, and that way it could be verified. But I don't think that the numbers are necessarily needed 100%. The sticker's fine.
Thank you, Ms. Sinsky, for looking into that.
Sure.
Yeah, thank you. That's a good idea, something to explore. And while we're on, you brought something up, Mr. Timonier. I've already had a couple, well, I've had two phone calls, well, that's a couple, about people skateboarding or roller, I don't know what the technical term is, on the new tennis courts.
Oh,
So maybe we want to put a sign up, no skateboard, roller blading, whatever the terminology would be.
we'll get another one made.
Yeah, maybe we could stick that up on the fence now, because those are brand new, so. All right, thank you, Mr. Crawford. Mr. Spillman?
Safety Forces is going to meet Monday, October 26th at 8 a.m.
Thank you, Mr. Spillman. All right, we're going to move on to the legislative part of our agenda. We have several items. We have 2020-91, consent for ODOT to replace our signs. 2092 was an ambulance purchase. 2093 is supplemental appropriations for the water treatment. 2094 is an agreement for the Office of the State Auditor to help with our gap conversion. And 2095, the hiring of an assistant superintendent at the wastewater treatment plant. Those would be our legislative items this evening. Is there a desire by council to handle these in consent agenda format?
So moved.
Second.
Motion by Mrs. Foglio, a second by Ms. Haynes. Is there discussion? All in favor?
Aye.
Anyone opposed? We will do so tonight in consent agenda format. Ms. Sensky, will you read the items for us?
Ordinance number 2020-91, an ordinance giving consent to the State of Ohio's Director of Transportation for replacement of signs on Route 20 within the city of Ashtabula, Ohio. Ordinance number 2020-92, an ordinance authorizing the city manager to enter into an agreement for the purchase of an ambulance unit and to utilize CARES Act funds. Ordinance number 2020-93, an ordinance to make supplemental appropriations in the Water Pollution Control Fund for current expenses and other expenditures of the city of Ashtabula, state of Ohio, for the period of January 1st through December 31st, 2020. Ordinance number 2020-94, an ordinance authorizing the city manager to enter into an agreement with the Office of the Auditor of the State of Ohio to assist the city of Ashtabula as fiscal agent for the Ashtabula Health Department in the conversion of cash reporting to GAAP for fiscal year ending December 31st, 2020. And ordinance number 2020-95, an ordinance authorizing the city manager to enter into an agreement with the Office of the Auditor. Oh, I'm reading that again. One moment, please. 2020-95 is an ordinance acknowledging the hiring of Mark Verzella as Assistant Superintendent, Director of Pretreatment, Class 3 of the City of Ashtabula Wastewater Treatment Division and approving additional paid vacation leave and compensation.
Is there a motion to waive the reading of these legislative items?
So moved.
Second.
Motion by Mrs. Foglio and a second by Mrs. Haynes. All in favor of waiving the reading?
Aye.
Anyone opposed? We will do so by a 7-0 vote. Is there a motion to waive the charter requirements of 2 readings for the legislation?
So moved. Second.
Ms. Foglio moved and Ms. Harris second. Any discussion on this? Would you please call the roll?
Mrs. Foglio?
Yes.
Mr. Crawford?
Yes.
Ms. Young?
Yes.
Ms. Harris?
Yes.
Ms. Haynes?
Yes.
Mr. Spielman?
Yes.
And Mr. Roskovich?
Yes. And now on the adoption of the legislation?
Mrs. Foglio?
Yes.
Mr. Crawford?
Yes.
Ms. Young?
Yes.
Ms. Harris?
Yes.
Ms. Haynes,
Yes.
Mr. Spielman,
Yes.
Mr. Roskovich.
Yes. All items have passed by a 7-0 vote. So we're happy about that. And welcome, Mr. Vizela is with us this evening, so welcome to the city. We're happy to have you with us. Any other items? We will move on to new business. There's a liquor request permit for the Spring family doing business as Burrito Loco on Lake Avenue. They will add a permit Class D5, adding how do you say that? Spiritus? Liquor on a premises by consumption only, beer and wine on premises and off until 2:30 a.m. But as Mr. Franklin pointed out, we are currently on a 10 o'clock limit per the state order. Is there any discussion on this or concerns? All right, seeing none, that'll go on then without objection. Okay? And we come time to our meeting where, oh, bless you. It comes time to our meeting where any counselor or anyone at the dais can share with something that we may not know. So if you have something to tell us we don't know.
Mr. President?
Yes.
When we all got our pictures taken this year by Risha, I did ask, could we have Augie's picture that was up here all those years to be moved? So Masinski did actually get it all framed for us. So it is there. We do have it. That will be placed outside of the conference room that's named after him. And Mr. Timonere mentioned maybe getting a plaque under there so future people that come by and see that will actually know that this is Augie and that's room was named for his service in that.
Very nice. Thank you very much. Ms. Stansky, thank you for doing that. And for 60 years to the city service, that's something be nice. Is there anybody else have anything to share with council this evening? I will just mention that tomorrow is October 6th, and it starts early voting. So you can go tomorrow to I think they even have a separate office this year because they're anticipating early voting. So if that's something that interests you, if you're concerned about the COVID voting in the public and so forth, you can start that tomorrow. Anybody else? No? Okay, well, seeing no other comments at this time, we will adjourn and our next
Sorry,
meeting.
Mr. President.
Oh, wait,
I
I'm
thought
sorry.
you meant.
We do have one letter to read. Thank you.
Dear Ashtabula, this is from Home Safe. Dear Ashtabula County residents, as the month of October nears, our thoughts go out to you who have needed and supported our agency, Home Safe, through this difficult year and years before. October is National Domestic Violence Awareness Month, and we wanted to reach out to all residents to share that we all deserve healthy relationships, and if yours is not, help is available. Call 440-992-2727. Home Safe is committed to breaking the cycle of violence in Ashtabula County and surrounding areas through the provision of emergency and non-emergency services. Our mission is to assure greater awareness of domestic violence challenges through advocacy, education, and empowerment of individuals, families, and the overall community. Our agency is growing and changing, just like the times. Please like us on Facebook or at our website, homesafeincac.org. We created an awareness video by placing silent witnesses throughout the county. The Silent Witness Initiative is dedicated to creating awareness, hope, and healing by encouraging you to do what you can to help anyone in need of safety from an abusive situation. Statistics say that 1 in 3 women and 1 in 7 men will experience domestic violence in their lifetime. We will also be holding our annual Walk Against Abuse this year. We are encouraging participants to walk as individuals or in small groups. In light of restrictions caused by COVID-19, the pandemic has changed how we walk, but doesn't change the need for the walk. Send your pictures or video anytime during the month of October. Send us photos or post on our Facebook page showing your support for our cause to homesafeincac.org to join others in the fight to end domestic violence. Services are available whether you come to the shelter or just call. All services are provided free. Please reach out to us if you need help or contact me, Julie Wood, not me, but Julie Wood, Outreach Coordinator at 440-992-2727 or outreach at homesafeincac.org for more information or to arrange a speaker for your club, church, or organization. Warmest regards, Julie Wood, Outreach Coordinator.
Thank you very much, Ms. Hensky. Home Safe has been around a long time in Ashtabula. I remember being a younger person and helping move furniture there and so forth. So this certainly has served us a long time, so that's great to hear. And we want to remember that they're here for us. Any other thing from any counselor or anybody else at the dais? When's our next meeting? 5th, 12th, 19th? That's not a holiday. No. Okay. So we will adjourn. Our next meeting will be October 19th. Thank you. Everybody stay safe.